Hello, my name is Sarah Imamura, and I am a nurse in the RN to BSN Winston-Salem State University program. And we did a presentation on a vulnerable population, and we chose the Gaston County Detention Center in Dallas, North Carolina. Obviously, this is a very vulnerable population with juveniles from the ages of 6 all the way to 17. Today I was going to talk to you a little bit about the medical side, nursing side of the detention center and the different aspects of what goes on there with the juveniles. Specifically, there's some very detailed assessments that must occur during the first initial, when they're first admitted to the facility. Throughout my presentation, I'll just refer to them as detainees. These young children are obviously in maybe some great need of medical, dental, or psychiatric attention. So the very first admittance of these young people, within the first 2 hours of arrival, they do receive a very detailed mental and psychiatric evaluation, specifically for risk of suicide. Also, within 7 days of arrival, they do receive a very detailed medical and dental assessment. They're assessed for chemical dependency, any past history of psychiatric hospitalization or treatment, current or past needs of medical and psychiatric treatment, even if they had a history in the past of a suicidal plan or attempt, or whether right now they may have some kind of ideas or actions as far as suicide. Any alterations in their levels of consciousness, whether they are alert to person, place, or time. Obviously, if they have a psychiatric problem, they may not be. Any history of abuse is screened very carefully, especially for sexual abuse if they were abused as a child or in the recent past. Staff is required to follow protocol and report this as needed. Also, obviously, a lot of them are going to be on a strict medication regimen, and there is a nurse there 24/7 that is responsible for administering the medications. At some facilities, there's a specific nurse called a public health nurse who is responsible for infection control. Obviously, this could be a very big problem there with all the young people. She's responsible for ensuring that OSHA regulations are carried out to prevent the spread of any diseases. Also, other staff members that are there medically, there's a physician, not 24/7, but there is one that comes in to see the young people once or twice a week. There is therapists there that have been trained psychiatrically to evaluate and treat the children. There's also dental work, an assessment of their teeth. They have every 6 months, someone comes and cleans their teeth, takes x-rays or whatever needs to be done there. One thing that's very important at the facility is the teaching that's done to the young people, especially as far as abstinence, sexual abstinence. They also teach them, the young men, they teach testicular self-examination, or the young women, they are taught how to do a self-breast exam. So a lot goes on with the young people to teach them how to prevent disease, how to take better care of themselves. So I never realized how much goes on in the juvenile detention center. You just picture them kind of being locked up, but there's actually a lot that goes on there. They take very good